Well, if it's Wednesday morning, it is time for another About Mansfield Consumer Advice Series. I'm your host, Steve Casillo. Appreciate you being here today. And chances are pretty good you are doing one of three things. You're watching live on Facebook, you're watching the video on YouTube or LinkedIn, or you're listening to the podcast on your favorite podcast platform. Whatever the case may be, we appreciate you being here today. And chances are also pretty good, as I do, it may be possible that you or someone you know is pregnant or planning on being pregnant or has just delivered a child and may be also going through these symptoms. Let's bring her in. This is Dr. Jordan Adams from Calibration Chiropractic and Functional Health right here in Mansfield, Texas. And first of all, good morning. Welcome back to About Mansfield.
Good morning.
And today we're talking about stress through pregnancy. When we're talking about pregnancy, everything from conception through pregnancy to delivery, that it can lead to chronic stress. And first of all, everyone has stress in their lives, whether it's a little bit of stress or a lot of stress. What are some of the signs of stress, Dr. Jordan? And when does a person come to the realization that, hey, I've got too much stress in my life?
Yeah, so let's start by going into the fact that stress is not bad. I think stress gets a bad rap, and we are all going to, as you said, have moments of where we're going to feel stressed. Our body is designed to be able to ride the wave of stress, come up, but it needs to be able to come back down. And so to answer your question, when we get stuck in a stressful state, or sympathetic dominance is what it's technically called, we start to notice implications of our health. And these can have hormonal implications. Our heart rate can go up, our blood pressure can go up. We can have trouble sleeping, winding down at night. There's a whole cascade of health side effects that happen when we've been stuck in stress for too long. It alters our intrinsic stress management system, our ability to regulate some of these autonomic processes that our body tries to regulate for us.
Would you say that one of the signs of stress is when your shoulders go up like this?
Yes, when you wear your shoulders like earrings.
Oh, okay. I've not heard that term before, but yeah. All right. So let's get into, because I know that you love working with expecting mothers, and conception is one of the stress can play into whether a woman can get pregnant or not.
Yeah. So when we are stuck in that state of sympathetic dominance, we're sending the message to our body that now is not a good time or a safe time to get pregnant. And so while high amounts of stress aren't going to cause problems like infertility or trouble getting pregnant, it certainly plays a role in interfering with the ability to get pregnant. And there's some research out there that says women who have suffered with depression can be twice as likely to experience infertility as those who are not dealing with depression. So these are some big stats, and it's really important for us to be mindful of how our mental states impact things like the ability to get pregnant.
And so I would assume then you got to listen to your body.
Mm-hmm.
And a story that I had told you just moments ago off the air, that I know a woman that she and her husband were they're trying to get pregnant, and it turned out she became pregnant almost immediately after quitting her job. And there could be that correlation that, yeah, she had a really high stress job and she was no longer in that stressful situation. The body, relaxed?
Yes,
I don't know. This is why we bring in the doctor, because I don't know the medical terms and exactly what's going on. But yeah, she got pregnant like right within weeks after quitting her job.
Yeah, it's almost like your body is able to put the brake pedal on, right? So when we're in stress or that stressful job, we're on the gas pedal. Our body doesn't have time to slow down, to recover, to recuperate, And then so when we can take ourselves out of these areas of life that are stressful, and granted, we can't always take ourselves out of something stressful like your job, but when we have the ability to, it does help our body go into what's called the parasympathetic state, that rest, digest, heal, repair, get pregnant.
Okay. So from the conception stage, now we're pregnant. Congratulations. And what are some of the stress stages that women can go through during the actual pregnancy?
Right. And so getting pregnant can be stressful in and of itself. I think a lot of women have a lot of unknowns. It's like, what is adding another baby, whether it's your first baby or fifth baby? How is my family going to handle this? What are finances going to look like? There's a lot of what ifs, a lot of questions that you start to navigate once you find out you're pregnant. And then you have external factors. So some women have financial concerns, family concerns, and all of these things piled on. If we don't manage this appropriately, then high amounts of stress that linger throughout the duration of pregnancy can set a pregnant mom up for having a preterm baby, a low birth weight baby. And that high blood pressure can also play a role in increasing the risk of a condition called preeclampsia. And so there's a lot of health concerns that can come about just simply by having a chronic state of stress during pregnancy.
Leading up to delivery adds its own level of stress.
Oh, yes. Going into delivery stress can play a role in, I call it the fear, tension, pain cycle. And so I think a lot of women are surprised to hear that birth shouldn't necessarily be really, really, really painful or hard. But when we are in stress or we're in fear, we then create tension, and that tension can create more pain, which then leads to more fear and stress, tension, pain, which can create a very long labor. It can create a very stressful labor. And so as we go through pregnancy, if we can train our body to pay attention to how we're storing our stresses and to where our mind is falling into stressful patterns, if we can bring that into play when we go into labor, we also set ourselves up for an easier, more efficient labor too.
So if an expecting mother is listening to her body, she's realizing that she's not quite wearing the shoulders as earrings, as you said, but she's realizing that she's getting to a point where, hey, there is stress in my life. What can whether it's those who are trying to conceive, those who are in the pregnancy process right now, or those who have just recently delivered a child, what are some of the steps that they can do to relieve stress?
Yeah, to start with, notice your triggers. Notice what creates stress in your body and in your mind. And if you do have the ability to modify those triggers, then try everything you can to modify them. One of the examples I like to give is paying attention to the sources that you're listening to during your day. So if you have the news playing all day long, the news is more often going to create stress than not. So maybe, if you have to listen to it in small doses. Pay attention to what the people around you are talking about. Are they negative or are they positive? Do they bring happiness to your life? Do they bring stress to your life? So what is your support system bringing to the table? Getting outside in nature is a great thing, whether that's just simply sitting outside on your patio, enjoying your cup of coffee, or taking it further and going for a walk. Exercise has been shown to help us manage our stress. And of course, I'm a big proponent of yoga.
Absolutely.
Even being a chiropractor can help your body navigate sympathetic system, parasympathetic system balancing.
All right, I do have to ask this one question as a male, because a male and a dad, and who has been through, lived through my wife's 2 pregnancies. And so there's a thing called sympathetic pregnancy. Can dads also go through stress, expecting dads, the same stress that a pregnant woman is going through?
Absolutely. An expecting dad can have the same concerns, questions, what ifs. They may be a little more prone to the financial stresses of how am I going to support another kiddo in the family. The only thing they probably aren't going to have is the physical stresses of pregnancy.
Yeah, that makes
like
sense.
The low back
Hey,
Like
Dr.
that.
Jordan Adams, if someone wanted to reach out to you and get some more information, get those shoulders off the ears, and talk about whether it's conceiving, pregnancy, delivery, the child. If they want to reach out to Dr. Jordan Adams, how can they do that?
Best way, as always, is our website has all of our information. That's calibrationmansfield.com.
That's Dr. Jordan Adams. We do these 10-minute nuggets of information. I know it's been a few weeks since we've done this. I was on vacation. I was at a conference. I had health issues. It's good to have you back. And let's do it again next week.
We'll see you then.